And when I've watched your videos when you tip your head backwards, I'm like,
right.
what?
That's potential. That's how much range of motion in your neck.
God bless America. I couldn't even imagine even doing half of that. I could do it.
Wow.
As far as I can go. Hang on a second. Could you look up one more time?
Yeah. So what happens is you have to have all 7 members of your team working as a team.
Well, they're not.
They're not. There we go. A little bit there on the right. It's okay. Everybody walks out. There you go. Wow.
Oh my God, it freaking win.
Notice the sounds for like.
Hallelujah. Look up to the ceiling. Holy I'm sorry. It's just coming out of me.
Oh, that's a huge difference.
I know.
Oh,
That's
good
tough.
job.
That's tough. Oh, thank you. You did great. Yeah. You've lost all that range of motion in there. It's been. We can bring it back. We just got to stretch, maintain that. You really will.
There needs to be more of you.
Aw. Thank you.
Oh, you did so well.
I want to do that again. That feels so good.
So let's start from the beginning here. I almost noticed here it said tailbone injury when you're in 1985. You have a very interesting story. We're going to go through this. So tell me about the tailbone injury. What fractured your tailbone when you falling or?
Yes. So my girlfriend, my best friend, we were getting ready to go out, and I wasn't going as quickly as she would have liked me to, and she grabbed me by the shoulders from behind, and she went to knee me in the butt to get me going, just kind of like as a friendly and she nailed me right in the tailbone. Oh. Imagine being in high school and having to wear a donut, or you bring a donut and sit on a donut at school.
All right.
So yeah, that was my.
And that was when you were 15, right? Is that
correct?
All right. So you're 15 years old. You get knee in the tailbone. There's always a preceding injury that sets this whole story up. And you have had some X-rays I looked at it a second ago. They did a fusion of your right SI joint. This was 5 years ago. How long ago?
This was just right at the peak of COVID, so February of 2020.
So 3 years ago or so, they fused your SI joint. You got a lot of relief. Tell me about what you were feeling before that and what was going on.
Debilitating pain, unable to sleep, intimate time, shooting pain. I was using a walker at work to even try and function, and people were having to help me in and out of my car, and I could barely lift or move my leg. If I tried to roll from one side to the other when I was in bed, it was excruciating.
The most pain was where the dimple in the back?
Yep, and it would shoot into my hip, into my butt, around into my groin, and down my leg. And I don't know if you've ever heard of a hypervolt.
Okay, yes.
Do you know what a hypervolt is?
Well,
that massage gun?
Massage gun, yep.
I literally, before I ever got the hypervolt, would have to sit there and punch my leg while driving or sitting, because it just, I don't know, it just gave me some type of weird relief, but it was...
Nerve distraction, right?
I guess.
Like the Three Stooges, you get punched in the face, somebody steps on your...
And it would go all the way down into my ankle and my foot, but it was primarily in my SI joint area.
Well, you definitely, like I said, there's the joints in your lower back will give you kind of that local pain, and then when you're hitting the nerve, that'll go down farther down in your leg. We have an MRI of your lower back that I looked at. We have, I would say, something like 80% disc height loss at L5, and that's a very significant thing to talk about, and that needs to be treated. The discs are non-sensitive, and they are the tread that prevent nerves from being pinched. So as that disc becomes thinned, the hole the nerve goes through gets smaller, you start pinching the nerve. And so the good news that I saw in your MRI and even the report and the x-rays was that most of your spine isn't injured, and that a majority of your back is young, but a few areas are older. And the same thing with your neck, C3 through C7. So most of the discs in your neck, with a couple more severe than the others, are injured, while the upper neck isn't injured at all. So I have an opinion of leaving the areas that are injured alone, while most of the chiropractic and medical world wants to focus their treatment. I think you said 30 injections?
30 injections, an ablation.
An ablation. So everybody's been treating your lower back. They've been constantly trying to focus on the injured areas. And that's actually the story of my father, where he was chiropractically, for 30, 40 years ago, my dad was injured by too much stress being repetitively put into his lower back. And so the chiropractic that helped him was moving the work off the area that was injured, working on his neck for his lower back problem. Because a few things go on. When, for instance, we get so focused on the imaging, and I'm going to try to teach you something today that might give you some encouragement. The wires come through these little holes, and I think of these nerves like spaghetti noodles. If they're like an uncooked spaghetti noodle, it's taut, like a rope.
Oh, an uncooked one, yeah.
An uncooked one would be like stiff, right? And then if you move or tilt, does that make sense? The nerve will get hit because it doesn't have any flexibility to move with the movement.
Right.
So for instance, when I tilt to the side, the hole on that side gets bigger, right? When I bend forward, it gets bigger, right? And when I bend back, it gets smaller, right? So that hole is dynamic. And when we're talking about symptoms down the leg, we're talking about pressure on that, most commonly by a disc hitting it.
On the uncooked noodle.
Right. But what happens is when there's a curve in your spine, in the neck, even the neck curve alleviates tension on these cables. So they call it nerve root tethering. The nerve root is then allowed to be lax, and so it actually doesn't even matter how injured the discs are if the nerve can move away from them.
Right.
Nobody
Okay.
talks about that. Nobody,
Right.
nobody told you that having a lumbar curvature in your back means that the nerve has flexibility.
Right.
So even though I showed you, or I saw the X-ray MRI that 80% that height loss is down, it almost doesn't matter so much if the curve's in your spine, because that nerve will have flexibility to rope-a-dope, Muhammad Ali, roll with the punches. You understand?
Right. So that's why when people's necks are straight,
Everything then is tethered.
Problem.
Right.
Right.
Everything's tethered, and then now it has no. You're rigid. And then you have no ability to
right,
kind of move
bob and
with
weave.
things, bob and weave. That's what I'm trying to say. My father, some of the original chiropractic he had done that helped him, he had severe disc injuries in his lower back, similar to what I saw on your MRI, and they treated him up here.
Mm-hmm.
Now, how would working on it's something? We got to do some injections. We got to do something.
Right.
And my dad was helped by people adjusting this bone. So
I can see that.
your spine has, your neck has 7 vertebrae in it, and the first 2 vertebrae are very unique. There's no disc between the skull and atlas and axis. These top 2 bones. The first disc is right there at C2, and most of the work of your neck should happen here at the top, with very minimal happening at the bottom.
Well, when I rotate my head this way and this way, I can you hear it. When your brakes start to wear down, you can hear this grind.
Well, you're probably wearing out those discs in the lower neck,
I
right?
can
in the
hear
joints
it.
and
It's disgusting.
you want 2 things to help you. One, we're going to loosen up your upper neck, and then we're going to talk about how much I'm trying to get some of that curve back in your neck, because the loss of the curve, I saw that I think on your MRI, on your X-ray MRI report of your neck, saw the loss of cervical
Exactly.
lordosis, and that's what actually allows the discs to be injured. The discs wouldn't be injured if there was a curve in your neck. C3 through C6, these discs are injured in here. They're starting to shift out and hit nerves, and that's where the arm, the decurveins, and all the health of the tendons, the health of the tissue will atrophy.
Mm-hmm.
And so then you start to have arm symptoms, but it's all neurologically controlled in the first place, that the health of your spine is your health.
When they're talking about injections in my elbow and
Mhm.
injections in my wrist, I'm like, I feel like it's back here.
Sure.
Because my arms are attached to everything
Yeah.
here.
Right. So the story has been it almost mirrors my father's story, where everybody's
Yeah.
been focusing on your symptoms, and it's not to say that you don't have something wrong with your knee. I wouldn't doubt if there's damage. I mean,
Yeah.
it's like a plant with no water, a plant with no sunlight. The plant is going to wither, but it's the lack of nerve flow, the lack of electrical flow from the brain to the body that then causes atrophication. We call it neurological atrophy. You can have atrophy from no blood flow, right? If you
Right.
cut off the circulation, the whole limb will go without trophy nutrition,
Mhm.
without nutrition.
Well, and I've described the pain as basically almost like wearing a tourniquet. Like I feel like I'm wearing a tourniquet on my
Yeah.
arm,
It's a
and I don't
neurological-
have that. Yeah.
The story is a neurological tourniquet. So we want to see if we can alleviate some of the nerve root tension, that tethering that we talked about. So the more curve we get, these cables will have, like a cooked spaghetti noodle, the ability to move away from what I can see as the stenosis, the narrowing, the disc bulging out that are hitting the nerve roots. I know, we have pumas!
Yeah, pumas.
What's
No.
on?
Yeah.
Puma socks.
I just
Costco
noticed
probably, I don't
That's
know.
right,
that.
Good products.
Costco.
When you turn your neck left and right, is there pain when you turn?
It depends on the day, but I just have a limited range of motion.
Show me.
It's so tight. That's as far as I can
That's,
go.
that's about 45, if that, okay?
Mhm.
And then to the right?
And when I turn, I can hear it go.
So maybe you're a little bit farther to the right, but you go left again. Yeah, we're definitely, you've
And
lost.
if I tip, that's as far as I can go. If I can tip, that's as far as it's stuck.
Right.
And it hurts.
We'll check, we'll compare that at the end, see how you're.
And admittedly,
Mhm.
I crack and adjust my neck all the time.
Most likely the problem with that is that you're only gonna continue popping the parts that are moving already.
Right.
Right, the parts that are frozen,
I'm trying to get them to move.
We-
I cannot get it to release, and it's driving me crazy. And
That's-
that's why I got
that's my job. 'Cause we're gonna unlock the atlas axis.
Yeah.
In order for you to have injured the discs in your lower neck, it means the atlas must not be bending. Because 60% of the work of your neck is designed to happen at the top. And not just 60%, but the first 60%, meaning that as you turn your neck, 45 to 45 should just be your atlas.
Right.
And then when you go past 45 to 80, that's when you start to get your lower neck involved.
Mm-hmm.
So the question should be, how did you wear out your lower neck without wearing out the upper neck? And the answer, first of all, is that you can't actually wear the upper neck out. There's no discs up there to wear out. They're just joints. And stiffness of the upper neck, frozen upper neck joints, will then cause compensatory lower neck and then arm problems.
Right. And when I've watched your videos when you tip your head backwards, I'm like,
Right.
what?
That's how much, that's potential. That's how much range of motion your neck. You know,
God bless America.
You should-
I couldn't even imagine even doing half of that.
We should, well, your potential is the same as
It's
mine.
pretty cool.
There's no surgery in your neck, right? You have there's nothing
No.
limiting. There's
But,
just,
okay, let me see what I can do.
wow.
As
Yeah.
far as I can
All right,
go.
hang on, one more time.
Yeah. So what happens is you have to have all 7 members of your team working as a team.
Well,
They're not.
Coach, get in the game.
We got to get in the game, right? And if your atlas is frozen to your skull or to the axis, then you're then asking your lower neck to bend too much. And then what happens is, remember how I showed you on that model, when you bend forward, the hole gets bigger. When you bend back, the hole gets smaller. So that's where you almost like your body's protectively limited your ability to bend back for fear of actually pinching those nerves more. So it's like, no. You've lost that. We're going to take that away from you so that you don't hit those nerves. How can you help me? Well, when you bring your head back, I'm not going to make your lower neck doing it. We want your upper neck to be doing it. The atlas needs to actually bend, and that's
Yeah.
what's frozen. That's why you have, and like I said, 60%. So that's like half your range of motion comes from 2 joints at the top.
Mhm.
And if they're not working properly, you're going to have severe limited range of motion.
Well, and I have a history of migraines, so I mean, I'm sure that all of that obviously contributes to a lot of that.
How often do you have, give me more history on that, how often do you have migraines?
So I'm on multiple medications actually. I give myself injections once every 3 months as a preventative. And then even with that, I will still typically get a minimum of a migraine a week.
Okay, so 1
But
migraine.
that's good.
Okay.
I was getting like 3 to 5 a week before being on the medication. I have a couple of rescue medications, but if I don't keep it managed, they'll put me in the ER.
Okay, so the upper neck and headaches are directly tied together. Your loss of range of motion, the stiffness, the inflammation, that all is to the same problem. That as we get your upper neck healthy, as we get your neck curved back in your neck, that should alleviate, and you should be able to wean off or change what we're doing with there.
Yeah.
Good.
And I've had 2 jaw surgeries as well, which
Again,
you
connected.
Yep. So I
So
figure you would say.
the more forward you're, go ahead and turn this way. Again, turn this way. You look straight forward, you're fine. Okay. So the shoulders are rounded forward. That's one thing that's going on. So your head's only really about, not that far forward, maybe a ½ inch forward. Watch me for a second. You're not actually far forward, but what happens is your shoulders are forward.
Right.
If I actually pulled your shoulders back, the head's actually
Then
more
it's
forward.
Right, but it doesn't look like
it's
forward.
masked by the fact that you're saying your shoulders are rounded. You know,
I'm so tight here all
Right.
the time, and I'm just like.
so it kind of hides the forward head posture, but the forward head posture, loss of cervical range of motion up here at the top.
Trying
It's okay.
It feels so awkward.
It's okay. Well, it's just I know, but you say your shoulders are here. You're
Yeah.
saying the shoulder should be here.
to. Yeah, when she did my tattoo, she was like, if we did the center, it would be way up here. So we have to do it.
Aw, it's a beautiful tattoo.
Aw.
Thank you.
Yeah, it's a
Yes,
So-
yes, I understand.
I know
Correct.
that
Shoulder
she-
should be
Like,
more there. Yes,
yeah.
ma'am.
But because it's not, she was like, we gotta kind of,
Alter where we're
Yeah.
putting the center here. All right, hips are actually, left hip's a little high. Very minimal. That's actually pretty, see they're about even here. So the hips are, but you're definitely, your left shoulder is elevated. Your head's actually translated to the right. So it's almost like your body's trying to alleviate symptoms of here. So what's going on is your head's tilted to the left. If you follow my steps here, you have an injury on the right side or pinching going on the right, which is why that right arm is having symptoms. So your body's tilting your head left. The holes are getting bigger on the right to compensate. You can't walk around with your head tilted, it'll make you dizzy. So what you've done is now you've dropped your right shoulder, and now it's been here long enough that now actually the head's actually translated to the right. I'm exaggerating, but the head's actually translated
like, wow.
to the right. That's what's going on. But
Yeah.
it's really, we'll find it in a second, the right side of your neck is what needs to be worked on. I mean,
Yeah, and this is the side that I'm always like, hey, will you please take your elbow and
Yeah,
grind it into my
yeah.
shoulder? And
I'm gonna get it in a second.
yeah, and I'm
What
afraid.
we're gonna do is we're gonna focus on middle back. I suspect we're gonna find a lot of restrictions.
Yes.
Bra strap, middle back area. That's most likely the young part of your back. What I saw on your imaging indicated that it hasn't aged at all. You're not chewing on those teeth. Let's start learning how to actually access that middle back, and then steps in the future that you can use to continually keep that area. Give me your hand for a second, it'll make more sense. Your middle back
Yes.
is supposed to be.
Mine
understand?
doesn't do that.
It's like you can feel the vertebrae, right?
Yeah.
See
Yeah, no,
how
mine
it
doesn't do
moves
that.
in and out. You understand if it's totally frozen in here,
Yeah.
see how now it's frozen.
Yeah.
no
and mine's
movement.
even, I think, rounded.
So if this is locked,
Yeah.
all my bending happens here. And then you have the L5 joint will refer pain to the glute. You then have the SI joint giving you pain in the glute, the neuritis down the leg. Let's shut that area down.
Right.
And let's move the stress. And then what I could see on your x-ray is some of that curve is gone. So let's try to work on bringing back some of that lumbar curve, again, to alleviate that nerve root tension.
Yeah. So what you were saying about the tightness on this side,
Yes.
it's because this side's,
You have a avoidance. So what's going on is your head is tilted. So you have contraction of the muscles on the left because you're trying to reduce pressure. There's nerve root. You're hitting the nerve on the right. So your head's just, it's like if I break my right ankle, there we go.
exactly.
It's all better. It's not better. You're avoiding it, right?
Yeah.
So now your left side's going to compensate and have an injury as an avoidance of, but it's really a right upper lock, which is what I'm going to feel in a second. It's posture always tells a story of source, and I'm going to find
Okay.
the source. But it's the right upper side.
That was very eloquent. Posture always tells the story of the source.
There's always a.
That was
You
very
have, to
eloquent.
read, you have to read the posture, right? The body's telling you where it is.
The posture tells a story. I like
Right?
that.
Like if I was standing like this, I'm like, no, I'm fine. Well, why are you doing that? Because I have an injury over here that's created an avoidance.
Mm-hmm.
You know, my wife likes the analogy I've used, which is if a room is filled with glass and poopy diapers and smells, right? Nobody wants to spend time there.
Right.
Right? Why would you want to spend time in a room? Well, we need to force you in there. We need to get you in that room. No, how about you remodel
Build up
the
your
room?
tolerance.
Right. Why don't we remodel the room, clean up the mess, put a new TV, put some ellipticals, and put some,
Yeah.
equipment in there, and then your body will want to be in there, right? So I don't force the body into places it's trying to naturally avoid. You clean up the reasons for why the body's avoiding them, and then the body won't avoid. That's how you fix the source, not by throwing the work back onto the broken ankle. It's like, how about we fix the broken ankle, get it better, and then your body will,
Oh, yeah.
okay,
Celebrate.
sure, I can stand on it. It doesn't hurt anymore to stand on it. Of course you're avoiding it if it hurts. Take one deep breath in for me. Deep breath in, and let all the air out. It's okay, here we go. Yeah, deep breath in. It's too tight in here. Exhale. Let it go. Deep breath in. I got you. One more. Let it go. Yeah, it's okay. Stay there. Stay there. Yeah. If that moved beautifully, I'd be confused.
Right?
Wouldn't make any sense. How could she have worn out her lower back if her middle back was functioning the way it's supposed to? Yeah, wow. Big knot here on the right.
Mm-hmm.
There it is. There's your source.
Mm-hmm.
All right, turn it left, real gentle. Mm-hmm. Easy, easy. It's okay, I got you. It's okay. Easy. There we go. A little bit there on the right. I got you. I just want to restore function to that top bone. There you go. Relax here. There you go. Yeah. And right there's.
Yeah. I've seen you use the scraper. I'm like, give me a
yes.
scraper.
Oh, we're heading there in a second.
God, I'm like, where do you grab
There's going to be a
this?
mark right here. It kind of,
Yeah.
there's like a fluid water balloon feel underneath the skin here, like all that. I call it like a
I wish I
fluid.
could do that to myself.
Oh. Well, I'm going to give you the next best thing, which is a device called a Deneroll that emulates my thumb and allows you to. It's like it's a spinal orthotic. It's a cervical orthotic that molds the curve back to your spine,
Sweet.
and it's as close to my thumb as I can sell. But it holds you and emulates my hand and holds you in this curved position.
There's a lot of chiropractors in the world.
Yeah.
They all just like the radiologists
Uh-huh.
say all these unique and different varying opinions.
Sure.
How do you find
Right.
the right people to
Right.
help you?
Yeah, it's a blessing and a curse. The freedom that chiropractors have. There's no, our scope of practice is very broad. With that is a lot of freedom, right? We have a lot of ability to do what we want. But with that is a curse also, is that what I do isn't what anybody else does. And so every artist draws different art.
Right.
There's only one Bob Ross, and
We love that.
nice
Happy
little
trees.
happy little trees. Anyway, but my point is that it's talking. You got to call and ask them what they do. But to give you an idea of how I would call unpopular what I do is the maker of the Denerolls. I was at a seminar a couple weeks ago, and the guy who invented the Denerolls and does all the research. His name is Deed Harrison. He's the founder of chiropractic biophysics, along with his father. He was at my seminar. He hasn't been at my seminar in 20 years. He hasn't been to Florida in 20 years, and he was actually at my seminar. And he's the most researched chiropractor that exists right now. He was at the FCA convention in Orlando a couple weeks ago. Which is the largest chiropractic convention in the world. 1,500, 2,000 chiropractors are at this convention. He had a room that could seat 150 people, and I was all worried. I'm like, Dad, we got to get there. Deed Harrison's there. We're gonna be in the hallway. End up getting there to the room. There's about 40 chiropractors. Okay, to give you an idea of how unpopular
Right.
corrective care is, at the most populated chiropractic convention, there's 40 of us in the room with Deed Harrison. Okay, not popular.
Right. And you're here to help people.
The therapy booths, the electrical pads and the lasers and the therapy are overflowing, right? That's where all the focus is in chiropractic, is in, symptom alleviation versus understanding where is it coming from, right? Why is the disc bulging, right? Instead of trying to inject the disc or do something to the disc, can we understand why certain discs? What I was trying to say earlier to you is that most of your spine is uninjured, right? What many chiropractors and medical doctors call unremarkable. They look at the uninjured parts of your back and say, nothing to see there. And they focus on the injured parts as the remarkable areas.
Right.
It isn't unremarkable that most of your spine hasn't aged. And you need to give an explanation for that. You cannot, to understand the story of your spine, it is necessary to understand why most of your spine hasn't aged and to give an explanation for that. What's your explanation, Dr. Ed? Those areas don't bend, they don't move, they're not functioning. And so you're not wearing out the teeth that you don't chew on, right? The parts of your spine that don't work don't age, and the alignment that you're in is incorrect, therefore keeping this wear pattern whereby certain vertebrae are doing all the work and certain ones aren't doing anything. So we have to do, your care is twofold. Restoring the function to the young parts. Now they're not going to appreciate it. The right side of your neck is tight. It's going to take some time to restore, and you might have to find somebody and guide them through this understanding, like, look, I want you to leave my lower neck alone. I want you to leave my lower back alone. I want to focus on my upper neck, my middle back, help keep me supple, and I understand how, at home, how to stretch, which we're going to go over today, things you can do at home to retain the work that chiropractors like myself do to you.
Well, and part of the beauty of recording this is to be able to see that back and recite that and to be able to communicate that in my community, because, I can't take you with me.
Right, I know. No bottle of Dr. Ed. I've said it for years.
Yeah.
Where's a bottle of Dr. Ed? But it just, you have to sit here and work this joint. This is frozen, and it's kind of boring. It's just, you got to sit here and rub
But
and
see,
squeeze.
most chiropractors will not even take the time
Right.
to do that, and they'll, you're really tight, and then they'll send you anyway. I'm like, well, but wait,
Right,
can you
work
help
it.
me get untight so that you can do what you need to do?
Correct. You can't even properly adjust this because it's so swollen. It would actually take a few visits to actually get this to actually move properly. But we're going to give you as much as I can today, and give you a plan for action of attacking this. There we go. But see, I mean, there's no knot up here. It's all smooth.
And the funny thing is that's where I feel like I'm so tight.
Right. Well, it's the muscles are cranked down, but the bones are not out of place.
Right.
They're actually jammed together.
Mm.
The right side is displaced open, like a drawer. The right side of the drawer is open, the left side of the drawer is shut. The drawer's crooked, kind of idea.
Right.
And I want to level the drawer and then push it in evenly together. But yeah, this is definitely elevated right here. Yeah.
Yeehaw.
Yeah. Yeah, real quick it comes out. There it is.
Purple and up.
Yep.
Oh, wow.
I mean, that was like what? That was very gentle swipes.
Very gentle.
Yeah, I mean, that's about as gentle as I can slide this over you.
Yeah, I'm like.
I mean, it's purple from here to here.
Wow.
All the stagnation, tightness that's been trapped in here has to be unlocked. There you go.
Do you ever go to the high schools?
You know, it'd be interesting.
It would be, wouldn't it?
Yeah, I've been asked to come to a couple different places. I think I might get kicked out. I'm not sure. Not clear to me if I might ruffle some feathers, you know.
Well, like doing the right thing is never popular, right?
Yeah.
So,
you
but I
know.
love that.
Mom, Dad, this guy had some really wonky ideas on how to stay healthy.
What's your philosophy on cupping?
Great technique. Yeah, no, another little milder than Gua Sha, but perfectly fine. I like cupping. It's just a little bit more mild, a little longer to take. You know, it takes 10-15 minutes. You put them on the back. No, it's great. Great flushing technique. Many things in life, we live very sedentary in terms of our world, and driving and sitting. And if we add up how many hours a day we sit, you know, people are usually up at 10 plus hours a day. And so what does that entail? Well, this area is frozen, right? We're not mechanically moving in here. Even though we might be walking around, you can live most of your life with no mobility up here. And you don't, you know, like I said earlier when you had your hand on my back, you can feel that my vertebrae, everything's moving, right? And this is rigid, way too rigid. And this is the source for why another area had to compensate and do double because this was doing nothing, right?
Mhm.
Other areas had to do more to make up for this not doing what it's supposed to be doing.
And why is it not doing what it's supposed to do? Why
Right.
is it
Sure, yeah, well, this goes back to why we have to have ribs. Why do we have ribs? To protect our organs,
Mhm.
right? So they attach, well, the first 10 attach to the costal cartilage or the sternum on the front. And so we have to protect our lungs and heart,
Mhm.
right? But with that protection that the ribs provide, it makes it easier for these areas to become frozen.
Mm.
And so we need to be actively, now it was okay in a world where we were moving around a lot from a young age. But now most 5-year-old, 8-year-old, 10-year-olds are sitting 14 plus hours a day. So while you're growing, you grew in a chair.
Mm.
So part of your spine has done too much, and then part hasn't done enough at all. And the problem's right here. It's right. This is the source right here. And if we can, in a minute, we'll show you some stuff on your back where you can shine a spotlight on here and try to wake this area up. And then tomorrow morning, Ed, my middle back was killing me. My lower back felt better and my legs felt better, but now my middle back is killing me. And
Oh my gosh, if my arms feel better, I'll
Mhm.
be like celebration.
And we got to get these ribs down here. The ribs are elevated. All this is elevated here. Oh, that has to go down.
Kingsley, are you taking lessons?
Oh yes, oh yes.
Ugh.
Right there. You didn't even know that was there, did you?
Oy, oy,
Mhm.
oy.
If you need a break, let them know.
Mm-hmm.
Don't
Please.
hesitate.
I'm ready for the abuse. This is what we're paying for.
I don't wanna. I don't wanna.
I'm like, just keep breathing. Just keep breathing. Feels like Russell.
There's an elevation of the rib. I think they call this a washboard. You know, it's like as the ribs elevate, they become more pronounced, and then it feels like you're running over like a ridges. As the ribs go back downwards, they kind of fold over each other and then become less apparent. So when the head goes forward, the ribs here elevate. Not only are they elevated, but everything's frozen. So you have to mobilize it, and then we'll show you how to stretch. Trying to get downward pressure to. You'll see many chiropractors, to me, adjusting the wrong way. They push upwards here. We want to push down because we're trying to close the ribs. We're not trying to open them. But you can get a pop opening a joint or closing a joint. And it's generally easier to get a pop opening a joint and get a louder one, so it makes a cool YouTube video. But
Right?
we're trying to mechanically close these.
Oh, yeah.
Oh yeah! Waiting for the Kool-Aid. Waiting for the Kool-Aid man to come busting through the wall. Boom, boom.
Ferris bueller.
Yeah, Ferris
Yes,
bueller.
the Ferris
Boom,
bueller.
boom.
Oh,
Oh yeah!
that's what it sounded like.
Boom, boom, boom.
The funny thing is, interesting little thing about Ferris Bueller.
Mm-hmm.
When Jennifer Grey is at the police station
Mm-hmm.
and she meets Charlie Sheen, who is,
Yes.
the troublemaker. Her name in the movie is not this, but for whatever reason, he asks what her name is, and she goes, Shauna. Like, why? Not all news.
Right. That movie is so funny. I forgot.
Boom, boom. That's right.
Oh my
Mm-hmm,
God.
mm-hmm.
Mama sa.
Get down on it. Get down on it. You said it. You can get down on it. Real gentle, just pouring out right here.
Mm-hmm.
Like I said, you could put cupping over here too, another way, but I find this to be, I don't know, so I'm not missing anything. I feel like sometimes with Gua Sha, or the cupping, you have to kind of replace them and move them around
Mm-hmm.
to get full coverage of the tissue. And it's fine as long as you can kind of take them off and reposition them. I like the Gua Sha because it combs the entirety of the tissue,
Mm-hmm.
and I feel like I get I don't miss any spots.
Full coverage.
Yeah. Well, you can with and I know that you can. There's certain cuppings that you can actually have them sucking, and then you can move them around with it. So there are options with cupping. I find this to be the most effective way of getting it done quickly. Right there. usually monsters, I call it, being back here that make your body round forward. And also, part of the shoulders rounding forward is it opens up the nerves. The holes that the nerves pass through in your lower neck get larger when your shoulders round forward. So it's another compensation because of the disc injuries in your neck. Your body's avoided them by rounding your shoulders forward.
To try and keep them open.
It does open up the foramen a little bit, right? So with the knowledge of that, when we bring your shoulders back, we have the potential to hit things, and so we have to do it slowly. You want to make sure that it give your body time to acclimate to that posture change, which is why it's really a 1-2 year process to change someone's posture. And because most chiropractors don't do correction, they're really not doing anything to stop the reason for why there's difficulty, which then leads to the constant need to be adjusted because it's not holding, because we're not doing any stretching to allow for it to hold. Again, 2,000 chiropractors were at the seminar and 40 chiropractors in the room.
Right.
When the guy is talking about how to get things to hold,
Right.
it's not really, my profession is not really interested in that.
And the thing is, you'll never put yourself out of business, right? Because even when you help somebody, even if
Sure,
it takes you
sure.
however long,
Tell your
for
friends
every
about
one
me.
you
Sure.
heal, there's another one that needs it.
Sure, the goal is to help people get better, and then to some degree you have to get checked up on so you can keep doing your home work.
Maintenance.
Right.
My mom, she went to the chiropractor very regularly. Firm believer in chiropractics. And she's like, should have married a chiropractor.
Yeah.
My dad was like, yeah, it would have saved me a lot of money. Ay caramba.
I know. The monsters that hide underneath here that I'm friends with the monsters under my bed. There's a monster underneath the scapula here.
Yeah, always.
Called Icarumba, is right.
We have named the monster.
Right.
Holy cow!
So yeah, that's that side there. That's where the problem is, up here on your left. This is just the abuse from this being. Yeah, we got to clean all this out.
Yeah.
What's your neck? There's one side.
Do you want to see? You saw it? Were you like,
Right.
oh my gosh, you gave me a hickey, doctor. In front of your wife.
She's used to it. What you're gonna do is you're gonna tilt your head to the left for me. Tilt left as best you can.
Oh my god. That was the weirdest thing ever.
That was stuck.
That was loud. Did you hear that? That was my ear.
That was really loud.
All right, got you. Easy. Left. Tilt left. Okay.
Oh my god. I'm like, is my ear still there?
All right, easy.
Whoa.
All right, go ahead and tilt to the right. All right, easy. I got you. Tilt. There you go. Top of there.
That one was really loud.
Press back with your elbow into my elbow. Press
My
back.
elbow?
There you go. Yeah,
Oh, but that was nothing. That was just easy.
There you go. And then press back. A little press more back. Yeah. It's okay. Yep. I got your leg. There you go. Good.
Hey.
Ooh. Nice.
That was amazing.
Yeah, felt good on my hand.
Elbow hurts so bad.
Show me when you bend it, when you move it.
Well, it catches and cracks all the time. So I literally have to grab it and kind of go like that, rotate it out and do that to try to get it. So like if I'm doing something and it's bent, or if I'm holding something, or holding my phone, or even holding my grandson's hand, it gets stuck all the time.
Let me feel it.
And then when I go to straighten it,
Just straightening it hurts. Can you straighten like that?
yes, but when I go from bent to straight, and they said I have a tear in the ligament, and
He doesn't have to do the adjustment on it if you're
oh,
worried.
if it's going to help it, then I'm all for it.
Well,
I just
there-
want to let
the-
you kind of know what's going on in there.
Oh, easy. I got you. Okay. The joint feels pretty good. I'd say more like I say, you're saying the ligament's been injured. You know, but there's no direct injury. This is where, again, I'm thinking the health of this tissue starts to...
Well, they're thinking cubital tunnel syndrome, and so...
But you don't have repetitive abuse to your elbow gymnastically or some sort of repetitive trauma you put on your elbows.
No, so, well, I was doing a treatment. Are you guys familiar with cold sculpting?
Not so much with...
It basically freezing the fat.
Okay.
So you're putting an applicator onto the subcutaneous fat and strapping it in with these straps.
Yeah.
After it comes off, I need to aggressively massage that area
To pump.
to break down, bring the blood flow back to that tissue, warm it back up. Well, as I've been doing that, this has been just aggravated. Now, years ago, I used to paint houses, so maybe that repetitive motion. I don't know.
Lay back on your back for me. I want to check the shoulder here. The alignment up here. You're fine. The nerves are pressured. The brachial plexus comes right through here, and the nerves that essentially
I feel that.
in here is the problem.
Yeah.
This one continuous wire from here all the way down to your fingers. So the pressure can happen here.
Yeah, and I get
you feel it down there. Right.
Yep, and my pinky and my ring finger.
Your shoulders, like we said earlier with your tattoo, your shoulders aren't in the right position. So let's try to get your shoulders. But
Right.
again, the shoulder isn't in the right position because it's avoidance of your neck. Because we have nerve
all
pressure in the neck.
that.
Well, you have avoidance as a result of it. Now, which is causing elbow symptoms because the alignment of your shoulder is incorrect, making extra mechanical tension on your elbow. But when you move your arm around, it's not in the right position. I would be working on, and we're going to two birds, one stone. As we stretch your back, we're also going to stretch your shoulders with the understanding that we have to do it slow enough that we don't run into things that you're avoiding, or
Right.
at least so that it doesn't aggravate you so much.
Let me see that thing. I think it's awesome.
Just a little smooth comb, yeah, just a way to get blood flow. It's like a squeegee. It's a way to encourage the tissue to rinse out. I know. There's where it is, right in there. Yeah, right there. Yeah, right there. There you go. Yeah, even like letting that arm stretch, let that stretch that. This should feel odd. It should feel odd because your neck wants to be straight and I'm asking it to be curved. The goal is to have this kind of middle upper neck. Your head goes over the device. And then the first goal is I call it 20-minute stretches. You want to get through 20, if you did one a day, it'd be 20 days, 2 a day, 10 days, but you want to record 20-minute sessions on this. And that's the first step to restoring this curve in your neck. And as your neck complies and bends over this, your neck will become it'll feel more natural.
20 minutes.
For 20 times. So not all at once, obviously,
Right.
but if you
20
do
minutes
one,
a day for 20 days.
Correct, right. That'd be your first, or if you could do it faster, you could do one in the midday or one in the evening, that'd be 2 a day.
If you break it up like 10 and 10, or
It has to be 20
it has to
for,
be 20 minutes at
at one session.
sitting. Okay.
You don't get much of any benefit past 20. So again, I was just with Deed Harrison. We call it ligamentous creep. The ligament lengthens. The rubber bands on the front are so tight that even if we adjust, that tight ligament pulls it back out. So what you're trying to do is actually stretch the anterior ligaments, and in order to stretch them, they have to be held for about 20 minutes for there to be a change.
But then you'll get a saggy gobbler.
Oh, how about this? The only reason
Vain women
you're
here.
saying, but it only becomes that because your chin's down. You understand? You understand? If you had a curve in your neck, this would actually be tauter. One side is more out of alignment, so you could have the TV to the right, and you just do a little bit of right rotation, and you'd hold it like that.
For how long?
Same thing, 20 minutes. But
Oh,
when
okay.
you're doing your 20-minute stretch, if in doubt, keep your head straight. But it is okay for about a month for you to be in a little bit of right rotation to correct.
Okay.
So to get off this, I'll show you. You use one hand to lift your head.
Do you want me to do that now?
Go ahead, yeah. And then use your other hand to grab the device and pull it out and then lay your head back down. Try to not use your scalenes or your neck muscles. Try to
Yes.
get off that passively. And so it just is an emulator of my thumb, and
It really is.
it
You weren't
says
kidding.
shoulders this side, so it goes like that on you.
Okay.
Put your arms here. Oh boy. Yeah, this is why your shoulders are way too high. Put them aside there. Breathe, breathe. Yeah, we got work to do here. Now, you need more care in your thoracic cage to make this practical. You know, this would take me in 5, 6, 7, 8 visits to get your chest loose enough. We'll adjust you again in a second, but you're way too tight relatively. Your neck is mobile more than your chest was. So my job is like a Sherpa to Mount Everest. I have to guide you up this mountain, and you need more guidance chiropractically to make this retainer.
In all areas of my life, doctor.
To make this retainer more amicable,
Yeah.
right, more doable is, you need to be guided a little more. But I wanted to give you a preview today of what this looks like. Okay, it would require you to be on your back. I do have about a 5-6 inch block behind your head. Eventually your head's on the ground.
Okay.
Do you understand? This is, because time is more important than depth. Stretch. Get the idea? You want to loosen that up. Then knees to the right. Okay. Then knees back in the middle. Now the idea would be to roll upwards. So you roll towards me, push
Now?
with your feet, come towards me. There you go. Very good. 1 inch. That's good. Just about 1 inch at a time.
Okay.
About, and then keep your butt on the ground. Put your butt down. There you go. I know. Oh, get the idea?
Oh God.
I know. And if it's too difficult, you roll back the way you came. But you want to move about 1 minute per inch.
Okay, got
So
it.
you roll back down a little bit, roll back away, run away. So it's going to be like an army. You're going to attack and then run away.
Retract.
And then attack and then retreat. All right, deep breath in. One more time. Here we go. Exhale. Easy. Let it go. Relax. I know. Deep breath in. It's okay. Exhale. Just see if there's any more. Chin down a little bit. That's okay. Stay there. You did good. There you go. A little more. Same joint moved at a deeper level there. We got it a little bit deeper. It's okay. Everybody walks out. There you go. Wow.
Oh my God, it freaking win.
Notice the sounds were like,
Hallelujah.
it was like muffled. Do you notice the difference in the sound?
Yeah.
You're saying the left side was like,
This was deeper.
It's like fluid. Yeah, it was all, there's inflammation in there from, I would actually, maybe the knee to your butt and went up to your neck too.
Thanks, Julie.
Julie, what did you do?
You broke me.
There's always a story beforehand that creates these, and that was the first domino.
That was the very first domino. Then there was multiple dominoes since then.
Let's check your range of motion. So come up from when we're ready. Easy. Just show me, turn your head left for me a little bit. There you go.
Oh, hi, Doc. How you doing?
Not hiding over here
Hey.
anymore. Just turn your head right. There you go. Yeah,
Oh
much
my
better.
God. This is
No.
I looked up to the ceiling to see that.
holy balls. I'm sorry. It's just coming out of me.
Oh, that's a huge difference.
I know.
Oh,
That's
good
tough.
job.
That's tough. No, thank you. You did great. Yeah, you've lost all that range of motion in there. It's been. We can bring it back. We just got to stretch, maintain that. You really well.
You did great.
No.
Happy tears.
Yeah.
No.
Well, you took it. You could get through the treatment. So good job.
Yeah.
There needs to be more of you.
Aw.
I want to do that again.
That feels so good.
Oh my gosh,
That's so cool.
Love you. All right, you did great. Thanks so
Thank
much.
you
All right,
so
appreciate it.
much.
Thank you.
Wow.